Hello, everyone. Thank you for connecting with our Facebook Live from Live Healthy Miami Gardens. Thank you, thank you, thank you. Live Healthy Miami Gardens is a coalition of 46 member organizations and over 100 individuals. And we're working collectively to drive citywide changes that measurably improve the health and life expectancy of people in the great city of Miami Gardens. Thank you for being here, and I celebrate you very specially on behalf of Tamara LaBruce, our program director for the Live Healthy Miami Gardens. Each Tuesday, we have this Facebook Live experience. Today, we will focus on brothers, our menfolk, and prostate health, or more specifically, managing prostate cancer. And now, let me introduce to you the person who will guide us. Mikhaela, thank you so very much for being here with us. And here is Mikhaela Dieudonne. Let me tell you a little about her. In fact, she is the perfect person to lead as Zero's man, and we'll tell you about Zero in a moment. In fact, Mikhaela will tell you more about this organization, but she is a manager of health equity in this organization. And she has been engaged in this work for a long, I better quit while I'm ahead in how long she has been a part of this work. She is quite prepared as well. She earned a Bachelor of Science in Public Health and a Bachelor of Science in Biomedical Sciences from the University of South Florida, and is currently pursuing her MPH at the George Washington University's Milken Institute School of Public Health. Well, Mikhaela, thank you so much for being here.
All men are at risk for.
Could you tell us any more of you, and then tell us about the organization that you represent?
Sure. Thank you so much for having me, Father Ward, and thank you to the Live Healthy Miami Gardens Coalition for giving me the time to come on the Facebook Live and to kind of introduce myself and Zero to the Miami community. So like you said, my name is Mikhaela. I am the manager of health equity at Zero, the End of Prostate Cancer. Zero is one of the largest national prostate cancer organizations that's focused on support and advocacy for people who have been diagnosed or who have been affected by prostate cancer. The organization was created in 1996, and it was originally called the National Prostate Cancer Coalition. But of course, over the years, as things kind of changed and evolved, so did the organization. And after a lot of different partnerships and work, it became what it is today, which is Zero. So we have a number of different ways that we like to provide support and advocate for people who have prostate cancer, who are at risk of it, who are trying to seek treatment and survive it, and also for caregivers and family members who have been affected by it as well. And that's going to be part of the subject, basically, of my presentation today. So once again, thank you so much for having me.
You're welcome. Thank you so very much. So let's jump right in. What is prostate cancer?
Right. So prostate cancer basically is a disease of the prostate gland. For a lot of us, men and women, we may not have any kind of prior knowledge of what exactly the prostate is, where it's located, or any kind of information about ways that it could be affected. But essentially, the prostate is a gland about the size of a walnut. It is not found in people who are assigned female at birth, but it is found in people who are assigned male at birth. So anyone who identifies as that would be someone who essentially has a prostate and unfortunately could be at risk of developing something like prostate cancer. Um, it is something that you may not necessarily know that you have initially because you may not experience many symptoms. But it is something that we do definitely encourage for people to get regular screening and do different types of preventative measures in order to keep themselves healthy and to hopefully prevent or mitigate any effects that you might get from prostate cancer.
So our conversation here this evening, having defined what is prostate and having also explained the importance of paying attention to the prostate, especially, we're going to continue on how to better understand prostate cancer and how to manage if you have this condition.
Exactly. And that's basically what I'm here to do today. I have hopefully not too long of a presentation that'll just give a little more background about how prostate cancer affects us as a country, how it affects, men and other people who are affected by prostate cancer in their communities, and how there might be certain people who are at a higher risk of developing it, either because of economic, social, healthcare related, or environmental factors. And so with that, if I could start my presentation, that would be wonderful. Next slide, please. So first, just a little bit of background about kind of how prostate cancer affects everyone in the U.S. So currently there are about 3.1 million people who are prostate cancer survivors in the United States. As you can see from the facts that we have in the sheet, unfortunately, African American men and veterans are at a higher risk, as well as people who are in rural communities and individuals who are of lower income. According to the American Cancer Society, the 264,500 men will be told that they have prostate cancer in 2022, and over 34,000 men will die of prostate cancer this year, which equates to about one man every 15 minutes.
Now, I would interrupt. Those are some staggering facts.
They are.
That currently there are 3.1 million prostate survivors.
Yes. Yep, there are. And that is a figure that is taken every year. So unfortunately, it is higher than we would like to see. We hope that by next year, it's something that has decreased because less men are getting diagnosed with it and having to survive it. But unfortunately, a lot of people don't realize, but rates of diagnosis for prostate cancer are at about the same as breast cancer. The two diseases actually have more of a link than a lot of people would realize originally. And so that's part of the reason why we're doing a lot of work trying to get the word out about prostate cancer so that way people can be more aware about their prostate health in general.
I'm appreciative that here we have this platform, and especially when I see where African American men and veterans are at a higher risk. So then, therefore, while we all, especially menfolk, need to pay attention, it is even of greater significance that African American men as well as veterans do pay attention, and to be able to, I'm sure you would want to talk about diagnosis and care and all that is necessary to be able to live a healthy life or a healthy lifestyle
Exactly.
amid the disease of prostate cancer.
Exactly. Actually, if we go to the next slide, I actually have a little more information about Black men specifically. So, about 1 in 8 American men will have prostate cancer in their lifetime, and it is unfortunately one of the leading causes of cancer death among American men. But that figure actually jumps to 1 in 6 for Black men in comparison. And so, definitely, it is something that affects certain groups within our country more than it affects others. In those instances, we see those are called health disparities. And so, part of my job and the team that I'm on, part of our job is to try and address those health disparities and try to achieve health equity within getting prostate cancer diagnosis and screening, prostate cancer treatment, and also survivorship for once you beat the cancer and you're in remission and trying to get back to your normal life. Can we go to the next slide, please?
Now, before you do, now,
Oh, sure.
when we talk about health disparity, somebody might be saying, what's that? At one point, when I began hearing it, I raised the very same question. What does that mean? Are you comparing 1 in 8 versus 1 in 6? Is that the disparity that you're referring to, or is it something else?
Yeah, so I am on what we call the basically health equity team. And so when we talk about achieving health equity, especially when it comes to prostate cancer, it basically means trying to ensure that everyone has a fair and just opportunity or chance to prevent, find, treat, and survive prostate cancer, and that opportunity will be given to them and will be fair and just regardless of their race, their financial resources, that they might have access to, or where they might live. But for a lot of people, as we know, not just with prostate cancer, but with a lot of other kind of health issues and just with the healthcare system in general, a lot of people don't have the same opportunities to get the medical treatment that they need and that they could benefit from so that way they could lead healthier lives. And so whenever we see those differences, and those differences are caused by things such as race, such as financial resources, such as location, those are what we call health disparities. It's basically those differences that we see. And so the goal is to try and make sure that everyone has an equitable chance. Everyone is
And so
able.
what we have here this evening, that is of intentional focus as well as being of great help to our menfolk, brothers, prostate cancer or prostate health counts. And that therefore we have, and for which we're truly grateful to have Mikhaela here from an organization known as Zero to help us manage and live a healthy life, healthy lifestyle in relation to our prostate, and especially in relation to the disease called prostate cancer. So,
Exactly. Actually, if we go to the next slide, I have a little more information about how we can hopefully and definitely work towards, you know, achieving health equity with prostate cancer and also just reducing rates of prostate cancer diagnosis and death in general. So, just to kind of reiterate what we were talking about earlier, we do see that African American men are one of the groups that are at a much higher risk of developing prostate cancer. They're at an almost 1.7 times greater likelihood to be diagnosed than for their white or European counterparts. And we also see that they're more than 2 times more likely to pass away from the disease in comparison to white men. And this is the reason why we very much advocate for things like early detection and early screening, especially for people who are at higher risk. If you go to the next slide, please. So this is kind of where we start getting into more specific information about, how you can prevent, find, treat, and then eventually survive prostate cancer. So as I stated earlier, it unfortunately is a disease that is diagnosed at about the same rate as breast cancer. A lot of men are affected by it, and a lot of men unfortunately pass away from it. But The, I guess, great thing about early detection is that it is great at saving lives, and it is one of the best ways for someone to be able to survive prostate cancer and to continue living a long and fulfilling and very healthy life. There are often no symptoms that are associated when it comes to early prostate cancer. And so that's the reason why we advocate, especially for men, to go and get regularly screened
Okay.
for it. There might be some conflicting information that you might see. I know that I've spoken to people who have stated that they, think that they're not supposed to get screened for prostate cancer until, their mid 50s. But definitely for us in our organization, especially when it comes to men who are at higher risk. So that would involve men who are veterans, men who have a family history of prostate cancer, and Black and African American men. We heavily encourage for screening to start at 40. And so that can look like a digital rectal exam. It can also be something as simple as a PSA, which is called a prostate specific antigen test. And basically, that is just a simple blood test that your doctor takes, and it monitors your prostate antigen. It's something that can be done once a year, twice a year, but basically, what your doctor will do is monitor that over a period of time. And if they see that that antigen is beginning to go up, then in those cases, they might alert you to start doing more in depth testing just to make sure that everything is okay. And if it's not, just so that way that can get treated.
And so, is
Whatever.
it
Oh, go ahead.
important um, to have a regular test or regular examination of the health of your prostate, and for us brothers to be open with our health caregivers, um, because the tendency, um, and I too was one who was extremely hesitant, reluctant to have this conversation. But again, what we're saying here is, brothers, our prostate count, and so we need to, as Mikhaela is doing here today, helping us to better understand, so we can better manage going forward. So,
Exactly. I know it's definitely not the most comfortable conversation to have, and it can be a very awkward experience, but definitely we want to encourage for people to take care of themselves, just as you should go every year to get your physical done. That's a great time to just, especially when you're hitting around your 40s, your 50s, but especially for men at risk, your early 40s. We definitely encourage for you to talk to your doctor about getting screened regularly, just so that way you can, take care of yourself and protect yourself against a disease like this. For men that are able to find prostate cancer early on, when it's in its early stages, there's a nearly 100% 5-year survival rate. And so these are men who, they did regular testing at the appropriate age, and their doctors found prostate cancer in them very early. They were able to get it treated, and they were able to continue on with their lives, just living their best life basically, after they're in remission. Unfortunately, though, when we see that the disease is detected late, the survival drops down to only 31% because at that point, the cancer does become more aggressive. So we always recommend for early detection, always recommend for regular screening, especially for Black men, especially for veterans, and especially for people who have a family history.
um, prostate examination is very important to me, and it's even more critical for my annual wellness, that this be done. Um, I did my wellness maybe three months ago. Fortunately, my primary care is on top of this. But I reminded her that I needed, not that I didn't trust her, but I wanted to take responsibility for my own self, for my own prostate. I think that's what you're saying here. I don't need to be uncomfortable. I don't need to sidestep the conversation. The point is made here that nearly 100% 5-year survival rate if disease is detected early. I really appreciate and thank you for reiterating that stark reality.
Yeah, and I definitely, it can be uncomfortable talking about these types of things with, your doctor and everything, but we also always advocate for, going to a doctor that you feel comfortable with, someone who you feel will be advocating for you, and also being your own advocate as well, which is the reason why we always try and provide our own kind of support and education initiatives at Zero to kind of help people who are at risk, patients, survivors, caregivers, family members, advocates, anybody who's affected or who wants to basically get involved in the fight against prostate cancer. We try to provide as much educational information, as much support, as many advocacy initiatives as possible, so that way people can essentially, advocate for themselves, advocate on behalf of their families, so that way you are getting, that medical care that you deserve.
Thank you for joining us here for our Facebook Live, sponsored by Live Healthy Miami Gardens, a health initiative in the city of Miami Gardens. My name is Horace Ward, and it's a joy to be here to host and to partner. I serve as the pastor of Holy Family Episcopal Church here in the city of Miami Gardens. Again, as I started to say a moment ago, our focus this evening, this afternoon, or this experience is on managing our prostate, and for our brothers to know that prostate management is crucial, and that prostate cancer is something that we best be aware of and be responsible to. Yes, Mikhaela, you were moving on now to tell us, where do we go from here? What do our brothers need to do?
So if we can actually go to the next slide. So Zero as an organization, like I mentioned earlier, we focus on a lot of different fronts. So we have an advocacy arm, a support arm, an education and awareness arm, and we kind of use a multi-tiered, essentially, approach to try and raise awareness and try and basically fight against prostate cancer. So we have a lot of different advocacy programs for research funding. We have veterans, prostate cancer survivors, people who are affected by the disease, whether or not they have it themselves, who go on Capitol Hill, for example, who will speak to our local and our state and federal government officials to try and advocate for bills that will make it easier for people to get PSA testing, for example. We are trying to push for more research into prostate cancer, especially more research that focuses on the minorities that we had spoken of in those vulnerable communities that we feel need more help. So like our Black men, Hispanic men as well, people who are in lower income communities and veterans. These are groups that need to have more research done so that way we know how to best treat them. And so that's another thing that we advocate for on our end. We also have a number of community events that we call the basically Zero Prostate Cancer Run Walks. They're generally conducted throughout the year, but we usually have the majority of them during September, which is actually Prostate Cancer Awareness Month. So we just essentially had the majority of them. We do still have a couple in October. For example, we had our Tampa Run Walk, which is where I'm located, actually just this past weekend. So that is another way for people who are interested in getting involved, they can do so. We raise money through our run walks, and that money is then used to essentially supplement and fund our other programs that we have for patients. Two of our biggest programs that we have are our 0360, which is basically a online database or online patient navigation program where anyone who has prostate cancer can call in if they need any sort of assistance with insurance, if they need financial aid, if they need social and emotional support, if they need benefits, enrollment assistance, any of those things, the 0360 program, which we partner with the Patient Advocate Foundation to provide, is one of our most comprehensive programs that we have. So for anyone who has prostate cancer and needs that assistance, you can always go to our website. You can email me. You can call our general line to get more information about 0360. We also have our patient support groups, or patient and survivor support groups rather. And we have over 100 of them, I believe, at this point, that are scattered throughout the United States. These support groups are online, some are hybrid, and some are also in person. And so for anyone who would like to get more support, if they're either currently in treatment or if they're a survivor and they would just like to have other people to talk to who had similar experiences, they would like to learn more information about things related to prostate cancer, like research and treatments. Once again, they can go to our website or they can contact me or our general line and learn more about getting into a support group and getting involved on that end. And next slide. So in addition to our large kind of programs or education and advocacy research funding that I mentioned earlier, we also have created a national database of prostate cancer testing sites on our website. You can go to it and you can also look online to see where in your area there might be places for you to go and get tested for prostate cancer. I also know specifically in the Miami area that the University of Miami Sylvester Cancer Center does have a mobile prostate cancer, or PSA rather, testing unit. And so whenever they're out in the area, you can go and get a free PSA test. So that way you can at least kind of begin, a baseline of getting tested and screened regularly. So that way you can monitor or have, a doctor or medical professional monitor your prostate health essentially. And then of course, with and also with Zero, we'll provide additional assistance for anyone who would like to have more or feel like they need to have more in-depth testing, assistance, treatment, or just more education about, what prostate cancer is, what are the different risks associated with it, how it gets treated, and what survivorship looks like after you've been treated and recovered from it. And next slide, please. So like I said, this is just basically a list of the programs that we have. As you can see, we have our 360 program. We have our mentor program for anyone who is a prostate cancer survivor and is either interested in becoming a mentor or having one. We have our caregiver connector. We have our prostate cancer veterans initiative, our prostate cancer summit, our drive, which is our transportation program for people that need assistance getting to or from their treatments if they have prostate cancer. And what I essentially specialize in, which is going to be our Zero Black Men's Prostate Cancer Initiative, is essentially a new program or new initiative that has been started up within the last year to focus specifically on Black men, since we do see that the health disparities that exist within the prostate cancer space affect them the most. Next, there was a little video that I did want to show. Hopefully it'll be able to be played. If not, then that's completely okay. But
cancer. So all men are at risk for prostate cancer. So no matter who you are, you want to have a fair and just opportunity to prevent, find, treat, and survive prostate cancer. And when everyone has the same opportunity, that is health equity. Unfortunately, different groups of people face more barriers when they try to prevent, find, treat, and survive prostate cancer. And these differences can be explained by biological, social, environmental, and healthcare-related factors. The largest differences are experienced by Black men. For example, when comparing Black men to other racial or ethnic groups, Black men in the U.S. are over 1.5 times more likely to be diagnosed with prostate cancer and over 2 times more likely to die from prostate cancer. These statistics are also different depending on where you live. According to CDC data from 2015 to 2018, In these states, Black men are more than 1.8 times more likely to be diagnosed with prostate cancer. And in these states, Black men are more than 2.5 times more likely to die from prostate cancer compared to white men. These differences by race and place are unacceptable. Even if your best clinical practices treat patients equally, this is not enough to eliminate racial disparities in prostate cancer. Given the different barriers that different groups face as they try to prevent, find, treat, and survive prostate cancer, the same solutions won't work for everyone. Instead of equality, equity ensures that everyone gets what they need to have a fair and just opportunity to prevent, find, treat, and survive prostate cancer. To bring equity to how men and their families experience prostate cancer, Zero is meeting the most critical needs of our community in our Black Men's Prostate Cancer Initiative. We are advancing research, providing support, and creating solutions to eliminate the differences for Black men and to reduce the burden of prostate cancer for everyone. That's the goal of Zero. But we need your help. From healthcare providers, we need you to be trustworthy partners to Black men in the healthcare system. From researchers, we need more research on the pathways leading to racial and ethnic disparities in prostate cancer and interventions to address these differences. From policymakers, we need you to develop and implement policies that explicitly target disparities, especially financial barriers to screening and treatment. And from all three groups, we need more open and honest conversations about racism in the healthcare delivery system and strategies to eliminate it. Visit us online to learn how we can all work together to create prostate cancer health equity at zerocancer.org.
Now, Mikhaela, how does someone top all of that? Wow. Kind of go ahead and add as you would like, please.
Sure. I mean, to be honest, with that video probably explains better than I just did in a much shorter time everything that we were talking about. But that is essentially the goal of our Black Men's Prostate Cancer Initiative, and also of our health equity team in general. We are aware that there are health disparities that exist in other communities, not just with Black men. I probably mentioned it quite a couple of times by now, but also for people that are lower income, for individuals that are veterans, for people who are in rural communities. And then, of course, there isn't even enough research that has been done for our Hispanic population or Spanish-speaking population, and also our Asian and other BIPOC populations either. And so our goal is to achieve health equity with all of our vulnerable communities, but we would like definitely to kind of start where we know that there is a huge health disparity, which is what we see with Black men. We are also advocating to see if we can have more research in rural communities for Hispanic men, for Asian men, and for lower income individuals. And some of our programs that we have at Zero, especially our Zero 360 program, is tailored specifically to help people who are in those kind of more vulnerable and underserved populations, to help them. But our goal is to try and achieve health equity for everyone. And so basically that's kind of some of the work that we're doing. Other events and everything that we have that are tailored towards health equity involve our Prostate Cancer in the Black Community film series. So that is basically a new initiative that we created basically earlier this summer, where we focus on bringing prostate cancer awareness and education to the Black community by showing a documentary that was created by someone who either was diagnosed with prostate cancer or was affected by prostate cancer through a family member that was diagnosed with it. And we had our first film screening in Atlanta earlier this summer, and we are going to be having a second one in Atlanta at Impact Church. But it is something that we would definitely love to expand and bring to other states, including Florida, including Miami. If anyone would be interested in having an event like that, we would love to have it here as well. We would also just love to expand our initiatives from starting in the Southeast outward, hopefully throughout the entire country, but definitely we're starting in the Southeast because we know that's where some of the diagnosis and death rates are highest for prostate cancer.
I have to jump in right here
Sure.
and extend and affirm very enthusiastically, passionately, the invitation that all of what you just mentioned, the kickoff would start in the great city of Miami Gardens.
We would love to do that. We would be more than happy to. I believe I've actually probably mentioned it to one of the other council members for Live Healthy Miami Gardens, that it's something that we, especially after doing our first one in Atlanta, we felt like it was something that we just had to do in other cities as well. And so just given the fact that I'm originally from Florida, we kind of had our eye on the Miami area. And so we would love to be able to do something like that. Also, we are in the works of trying to expand our Black men's prostate cancer support groups as well. And so we are also eyeing Miami.
Miami Gardens, Miami Gardens, Miami Gardens.
Yes. We're definitely eyeing this area for anyone that's interested. We would love to be able to come and fill whatever need or interest that people may have, or that anyone in Miami Gardens who either has prostate cancer or is affected by it. We would love to provide additional support and just be there for the community. Like I said, I'm originally from Florida, and so this whole area, this whole state is very close to my heart. And so if there's anything that we could do, to kind of bring more awareness for prostate cancer, to help anybody who's affected by it, just to prevent it from becoming something that is so detrimental to the community, then we'd be happy to do it.
We're happy, and you can see Mikhaela's information across the screen with her email address as well as her telephone numbers, which give her a call, connect with her. I appreciate your presence here, Mikhaela, and the enthusiasm you've shared as you have described the matter of prostate wellness and the care, the opportunities that where prostate cancer is, that we can and we do have the support. Our brothers and their families can turn to Zero for the help in navigating to a better health.
Yeah, thank you again so much for having me today. I kind of have known about prostate cancer personally for even for years, even before I started working at Zero. It was actually one of the first fields that I worked in as a student. So I worked in research a little bit, and I had previously worked under a physician who specialized in prostate cancer. And he also did research specifically focusing on Black men and men of African descent, and why they were having such a tough time getting diagnosed, why the death rate was so high for them. And just after my initial exposure in that field, I just kind of realized that that was what I really wanted to work in. I love doing support and advocacy work. Is something that I've always been very committed to. And I'm a part of an organization that believes that service is one of the greatest goods that we could do. And so we're here. We want to be an arm of support for anyone who's been affected. We would like to empower people who would like to learn more and who would like to advocate for themselves and for their communities, and we would like to advocate for our communities as well. So if anyone ever needs any assistance, prostate health and wellness and otherwise, please feel free to give me a call, send me an email. You can also call our general line, and then you can visit our website.
And so this afternoon, for our experience here on Facebook Live, our focus has been on prostate and managing and seeking healthy prostate. Brothers, again, um, prostate health counts. And when there is that of prostate cancer, we do have the support, the resources that our brothers, with our families, we can certainly work together going forward. Mikhaela, any last words from you as we bring this presentation to a close?
Just thank you so much for everyone who was able to join. I really appreciated being able to just kind of, I guess, talk about prostate health and prostate cancer, and hopefully raise a little more awareness, and hopefully for anyone who has been affected by it or who is currently dealing with it right now. Hopefully learning the information or being a part of this helped you feel a little less alone. If anything, we want to make sure that people still have hope that they can recover from not just prostate cancer, but any cancer or disease that they might have. And more than anything, we want everyone to know that they're not alone and that there are people out there who will give them help and support.
Thank you so very, very much. And I am Horace Ward from the Holy Family Church here in the city, and the great city of Miami Gardens. In a moment, I'm going to do a shameless plug of an event that is being offered to our wide community. But before I do, I also serve as one of two co-hosts to the Live Healthy Miami Gardens initiative, where I serve on the host council. Again, our purpose, the Live Healthy Miami Gardens initiative, in partnerships, seek to develop the health well-being of our community, of those who reside in the city of Miami Gardens, and our friends. Live Healthy Miami Gardens is here to serve all. As I said, I'm taking the personal privilege to share with you an upcoming event here at Holy Family Church in the city of Miami Gardens. As you can see on the screen, we have a music fest taking place on Sunday, November the 20th. And there you see where we have vocalists and we have instrumentalists. And so we invite our wide community to check us out here at the Episcopal Church of the Holy Family. My name is Horace Ward, and I can be contacted 305-934-5392. 305-934-5392. Once again, all, thank you so very, very, very much. And Mikhaela, we look forward to having you come back to share with us here at Live or through the Live Healthy Miami Gardens initiative.
Thank you so much for having me. I look forward to coming back.
Good. So, folks, enjoy the rest of your day. Goodbye, goodbye, goodbye.